Hey everybody, it's Pumill from Cross County Cardiology again. On this Wednesday, we're going to be talking about diabetes and its effect on the heart. With all our other videos, we've been talking about blood vessels in a bigger scale. The interesting thing about diabetes is that a lot of those things are supercharged. If you were to think about diabetes, I don't want you to think about the big blood vessels. I want you to think about the little blood vessels. So when you have somebody's heart off their aorta, right? You have your left main, which is your main coronary artery, and that divides into your left circumflex, your left anterior descending artery. Looks prettier in people, I promise, but you have your right coronary artery. You're gonna see this picture all the time. Cardiologists think about this picture all the time. You have a plaque developed, right? You have some plaque. It's small, it gets bigger, bigger, bigger. Eventually becomes, a blockage, and then we put a stent in and fix it. This is not where the blood flow goes. So this is the main artery, but how does it get to the actual tissue? So these tiny little invisible microvessels. We call it the microvasculature. So how do you get the amount of blood that goes from here to the single blood cell that actually perfuses the tissue in the heart? The microvasculature. And what diabetes does is it accelerates abnormalities or atherosclerosis of these little vessels. We can't put stents in them. We can't even see them. When you see people with diabetes, they have increased risk of neuropathy. Why? Because the mini blood vessels that supply the nerves are the first things that go. It can cause abnormalities of the nerves. Why do they have vision problems? Because the mini blood vessels of the eyes become abnormal. Why do people have shortness of breath? It's because these mini blood vessels happen here. They can have arteries without any significant blockages, but the abnormalities here can cause essentially the same thing. So when you think of diabetes, you have to think small. In summary, cardiologists like to deal with the big blood vessels. We can fix these. When someone has diabetes, you have to think about the smaller blood vessels. This is much more diabetes management, medications, exercise, quitting smoking, etc. I hope this helps. Thanks again for coming. We'll see you all next Wednesday.